Which component of the ECMO circuit is specifically designed to handle the gas exchange? A. Centrifugal pump. B. Heat exchanger. C. Membrane oxygenator. D. Venous reservoir. Answer: C. Membrane oxygenator. Explanation: the membrane oxygenator, often made of polymethylpentene, is the lung of the circuit. It separates the blood phase from the gas phase, allowing O2 to diffuse into the blood and CO2 to diffuse out. During the dry assembly phase, why is it critical to check the direction of the centrifugal pump head? A. To ensure the heater-cooler works. B. To prevent retrograde flow or accidental aspiration of air from the patient. C. To calibrate the flow sensor. D. To check for cracked housing. Answer: B. To prevent retrograde flow or accidental aspiration of air from the patient. Explanation: centrifugal pumps are constrained by the direction of rotation. If the pump head is seated incorrectly or rotating the wrong way, it will not generate the pressure head required to move blood toward the patient, potentially causing a backflow of blood or air. What is the primary purpose of CO2 flushing the circuit before liquid priming? A. To sterilize the fibers. B. To reduce the risk of gaseous microemboli by replacing air with a more soluble gas. C. To check for leaks in the oxygenator. D. To prime the pressure transducers. Answer: B. To reduce the risk of gaseous microemboli by replacing air with a more soluble gas. Explanation: CO2 is much more soluble in blood/saline than nitrogen, the main component of room air. By flushing the circuit with CO2, any small bubbles trapped in the membrane fibers or connectors will dissolve much faster once the liquid prime is introduced. Which priming solution is most commonly used for an initial crystalloid prime? A. 5% dextrose. B. Plasmolite or normal saline, 0.9% NaCl. C. Fresh frozen plasma. D. 20% albumin. Answer: B. Plasmolite or normal saline, 0.9% NaCl. Explanation: isotonic crystalloids like plasmolite or normal saline are the standard for initial priming because they are inexpensive and compatible with blood. In pediatric cases, a blood prime, using RBCs/albumin, may follow to prevent hemodilution. What is the role of the bridge in a standard ECMO circuit? A. To connect the arterial and venous lines for recirculating prime or emergency weaning. B. To provide a site for drug administration. C. To act as a backup oxygenator. D. To measure premembrane pressure. Answer: A. To connect the arterial and venous lines for recirculating prime or emergency weaning. Explanation: the bridge is a short piece of tubing connecting the arterial and venous limbs. During priming, it allows the fluid to circulate in a continuous loop to de-air the system. Clinically, it can be used during weaning trials to recirculate blood through the circuit while the patient is off support. When priming a circuit for a neonatal patient, what is the most significant concern regarding the prime volume? A. Hyperkalemia. B. Systemic inflammatory response and profound hemodilution. C. Excessive circuit pressure. D. Hypoglycemia. Answer: B. Systemic inflammatory response and profound hemodilution. Explanation: the volume of the ECMO circuit often exceeds the total blood volume of a neonate. If primed only with crystalloid, the patient would suffer severe anemia and hemodilution. Therefore, neonatal circuits are typically blood primed with packed red blood cells and albumin. During the de-airing process, why is it vital to tap the oxygenator and connectors? A. To settle the pump speed. B. To dislodge small bubbles trapped in dead spaces or manifold corners. C. To calibrate the temperature probe. D. To ensure the membrane is coated with heparin. Answer: B. To dislodge small bubbles trapped in dead spaces or manifold corners. Explanation: air bubbles tend to cling to connectors, shunts, and the pleated corners of the oxygenator. Physical tapping/vibration helps move these bubbles into the main flow path so they can be purged through the vent or bridge. What does premembrane pressure, primarily monitor during circuit operation? A. The patient's mean arterial pressure. B. The resistance within the oxygenator, clotting/obstruction. C. The venous return from the patient. D. The temperature of the heat exchanger. Answer: B. The resistance within the oxygenator, clotting/obstruction. Explanation: Pre measures the pressure before the blood enters the oxygenator. If the oxygenator begins to clot, resistance increases, causing pre to rise. A high delta P difference between pre and post-membrane pressure indicates a failing oxygenator. Which of the following is a wet prime safety check? A. Checking the expiration date of the tubing. B. Testing the bubble detector and low-level alarms. C. Ensuring the gas flow meter is off. D. Verifying the hand crank is in the box. Answer: B. Testing the bubble detector and low-level alarms. Explanation: Once the circuit is filled with fluid, wet, it is the ideal time to test safety sensors like the bubble detector. This ensures the hardware can correctly identify a catastrophe before the patient is connected. In a centrifugal pump system, what happens if the venous line is clamped while the pump is spinning? A. The pump will automatically stop. B. Large amounts of heat and negative pressure cavitation occur. C. The arterial pressure will skyrocket. D. The oxygenator will burst. Answer: B. Large amounts of heat and negative pressure cavitation occur. Explanation: Unlike roller pumps, centrifugal pumps are non-occlusive. However, if the inflow, venous, is blocked, the spinning impeller creates a vacuum so strong it can pull gases out of solution, cavitation, and generate significant heat, which can damage the pump and blood cells.